Welcome to the pre-departure orientation for FIMRC for your trip to Costa Rica. This orientation is meant to just go through a little bit more about who we are as a foundation, as well as go through the logistics to get you as prepared as possible for your trip. FIMRC's mission is to provide access to medical care for underprivileged and medically underserved families around the world. We implement our mission in all of our 10 sites. But the way that we do this looks different as we try to tailor the work that we do to each country and each community. As you can see here, we have a pretty heavy Central and South American presence, as well as our sites in Africa, India, and the Philippines. We implement our mission based off of 3 pillars: access, education, and participation. Again, because every country is different and every community is different, the way in which we focus in these 3 areas is different, as we really tailor each site to the needs that we're seeing within that individual community. Looking at access, we work really hard to ensure that the communities we serve have the ability to seek a healthcare professional, that they have access to healthcare services. If there's no infrastructure present, then we build it. And so we really provide this access to services based off of 2 main models, one being a clinic model. And so this is a FIMRC run and operated clinic. And that is what you will see in Costa Rica. In Costa Rica, we serve a large migrant population that cannot access the healthcare system within Costa Rica. And so that is why we provide primary healthcare services as well as psychology services through our FIMRC clinic. At some of our other sites, there already might be really great clinics or hospitals run by the government or other NGOs. And so we try really hard not to duplicate those services, but fill in the gaps. And so, for example, our sites in Peru, we operate off of a partnership model. And so we partner with local government clinics and hospitals to provide resources, to provide educational materials, to help with specialty care, different things like that that might be lacking within an already existing infrastructure. For education, we collaborate greatly with the community. We work hand in hand with community members and leaders to develop out the programs that we have. Before we even start a site, we do an extensive community needs assessment, looking at what the current needs are, what is the infrastructure, what are some of the common diagnoses that we're seeing, and really tailor our programs, again, to the needs that we're seeing within that community. We focus heavily on education and prevention. We work really hard to address social determinants of health that could be affecting access to care within a community. And really, you'll see, hopefully, during your time in Costa Rica, the importance of that education in global and public health. I like to use an example of diarrheal diseases. They're fairly preventable, with some education on basic hygiene, sanitation, things like that. And so it makes a lot more sense to go into a community, provide that education, as opposed to just providing access to a clinic that treats diarrheal diseases day in and day out. You can make such a bigger impact providing that education and prevention. And then our 3rd pillar for participation, we engage, like I said, closely with the communities in which we work. Again, before we even start a site, we make sure that the community even wants us there. And so part of that community needs assessment is, kind of looking at how involved community members want to be in our programs, as it is really essential that they take an active participation in the programs that we're offering. And we really try to build our services from the ground up. And then we also believe in participation from the global community, which is all of you, our amazing volunteers. We would not be able to do anything without you volunteers. We have a very unique funding model where over 90% of our funding is coming through our volunteer programs. And so that fee that you pay not only goes to help provide an amazing experience while in Costa Rica, but also goes to help support all of our site operations, allows us to hire local staff, provide medication, and do the work that we do day in and day out. So I like to take a minute and just thank all of you for your participation. Without you, we would not be able to have the impact that we do. Looking at our organizational responsibility, we focus greatly on sustainability. We are not a foundation that just has volunteer opportunities, a few times of the year, but rather we run and operate our sites year round for multiple years. And so our volunteers kind of fit into our existing operations, and we try to have you guys see that sustainability piece. We hire over 94% local staff members, and that is essential in allowing us to have the sustainability that we do. A great example of this is during the pandemic, the COVID-19 pandemic right now. We had to evacuate out a lot of our foreign staff from the US. And the only reason we've been able to maintain site operations is because we have that local staff member involvement. For example, our site in Costa Rica is 100% staffed by locals. And so they've been able to continue to provide access to clinical services and those health education programs, even during difficult times like the pandemic. We never start a site that we can't sustain for years to come. We always look at, how we can sustain that site. And again, really try to make that commitment to the communities where we work. You guys are participating in the Global Health Volunteer Program. This is our FIMRC flagship international volunteer program. You guys will be working alongside our amazing staff in Costa Rica, and really making meaningful and sustainable contributions to our site operations. So now we're going to get into a little bit more of the logistics of the trip, expectations, what you'll be doing day in and day out. Just to start setting those expectations, you are representing FIMRC, so please be professional and respectful. We've worked really hard to develop and maintain the relationships that we have within the communities where we work. And so we really expect our volunteers to protect that relationship that we have, and just, keep that professionalism both during work hours and after work hours during your time. Looking at your flight, when you arrive to Costa Rica, you will go through customs, you will grab your bags, and then you will actually exit the airport, go outside. You will see a sea of drivers all holding up a sign. You're looking for the guy with the FIMRC sign, that would be your driver. If you have any issues at the airport at all, if you lose a bag, you get stuck in customs for any reason, anything like that, the list that you see there is your list of contacts. So the first person to contact would be Rita. She is our homestay coordinator, and you should have received, or you will be receiving if you haven't already, a homestay email from her. And so it will have a little bit more information on kind of the logistics of arriving into Costa Rica. It will have your homestay family information and assignments, as well as her number. So what I recommend that you do is get WhatsApp. That is the best way to communicate with people in Costa Rica, and the best way to get in touch with both Rita and Tatiana Blanco, who's our field operations manager. And so I would download WhatsApp, save these contacts in your phone so that if you have an issue at the airport, you can quickly just WhatsApp them to try to get it resolved. In that packet as well, I'm going to take a tangent. It will have the address of your homestay. That is the address that you will use and put on your customs forms when you're entering into Costa Rica. Back to contacts. So if you can't get a hold of Rita, if you have issues at the airport, you will then contact Tatiana Blanco. She is our field operations manager, and her phone number can be found in the pre-departure packet that you should have received when you completed your online profile. So again, save her number into your phone just so that you have it and can WhatsApp her. If for some reason you can't get a hold of either one of them, we do have a FIMRC emergency line. Again, that number is in that pre-departure packet that you should have received when you finished that profile. And so go ahead and save that number as well. That rings to our headquarters staff's cell phones. And so we answer that 24 hours a day and can help kind of resolve any issues that might come up. Once you're with your driver, just so you know, all of our drivers have been vaccinated against COVID. However, masks are required in any transportation vehicle. You will see that there is a strong theme throughout this orientation. We're taking pretty strict precautions still against COVID-19, as the population that we work with is a very vulnerable population with limited access to healthcare, and that includes vaccinations. A lot of our patient population have yet to be vaccinated against COVID. So please, please, please keep that in mind. Even now, prior to traveling, if you're running to the grocery store, you're going to be in a public space, throw that mask on. Same thing in traveling at the airport and your airplane. I know that a lot of those mask mandates have dropped, but please be conscious of that and just throw that mask on for an extra protection. Once you're with your driver, he will then take you to your homestay. Our homestays are really nice. They have Western style amenities, and most of them have access to Wi-Fi, which again is a good reason to have WhatsApp. That will be an easy way to stay in contact with friends and family back home. You can use the Wi-Fi at the homestays and use WhatsApp to kind of communicate. You will get 3 meals a day at your homestay. Breakfast and dinner are served in the house, and then lunch, they will pack up a lunch for you to take to the clinic each day. All of our homestays are within walking distance to each other, as well as within walking distance to markets and cafes. And so it's easy to get together with other volunteers on site or kind of explore the city after working. Masks are still required in Costa Rica in all public spaces. So again, please make sure that you're wearing those masks. We are also requiring masks within the homestay. Most all of our homestay families have been vaccinated, but again, because we're working with this vulnerable population inside the house, anytime you're in a room with somebody else, whether that's one of the homestay family members, a construction worker, a visitor, anyone else, if you're in the same room with them, go ahead and throw that mask on. Our homestay families have gone through a training about our COVID protocol. And in that, they brought up 2 main requests for volunteers. The first being that you should bring a change of clothes. And so essentially, they don't want the germs from being in the clinic getting into the house from clothes. And so if you can bring something to change into as soon as you get home from the clinic each day, you don't have to bring, 5 new outfits. You can rewear those outfits, but just something to change into as soon as you get home. And then they also requested that you remove your shoes upon entry. And so they'll show you kind of where to put your shoes when you get to your homestay. Looking more at what you will be doing day by day, the clinic activities at the clinic is kind of helping with all of the clinic flow. And so that will include doing COVID-19 symptom screenings. We still are not seeing a ton of respiratory patients, as those are still being referred out to government health clinics for kind of tracking purposes. And so you'll be asking all of those fun questions off if they have had difficulty breathing, a cough. We'll take temperatures before they even come in. And so you'll be helping kind of in that station. You'll also be helping take patient vital signs. And so if you don't already know how to do that, you will be trained during your orientation on your first day. So you'll learn and be able to do that, as well as input patient data into our electronic medical record system. You'll also have the opportunity to observe consults with our primary care provider. And that's just a great way to learn a little bit more about some of the diagnoses that we're seeing, some of those social determinants of health that contribute to the diagnoses we're seeing, learn a little bit more about what diagnosis and treatment looks like in low resource settings. So it's a really great learning opportunity. You'll also be helping work in the pharmacy, as you see the ladies in this picture doing. And so you'll be helping fill prescriptions and dispense medications. Again, you'll be trained on that if you don't already know how. We also have our psychology program or our mental health program. And so you'll be observing with our psychologists as well. And then I really, really recommend as volunteers to just be willing and ready to do anything. COVID has put a strain on our staff. And so you might be asked to file patient files, clean, all of which are really important, maybe not the most glamorous jobs, but if you guys are cleaning the clinic, that means that the doctor doesn't have to, and she can see more patients. And so it really does help impact. And the more you are willing just to jump in and do anything and everything, I think the better experience you will have. And then just a note that masks are also obviously required in the clinic. We require medical masks or KN95 masks at the clinic. So make sure when packing that you bring enough masks, as you'll be wearing them pretty much all day, every day during your time in Costa Rica. Looking at our education activities, you will also be helping develop these. So we provide education as patients are waiting to see the doctor. And so you might be helping develop posters or creative education kind of talks that we do. And that could be involving, writing a script, developing fun activities like you see in this picture, developing posters, all of those fun things. And then obviously helping with medication education when working in the pharmacy. And then during the pandemic, we've also pivoted a lot of our health education to be virtual. And so you'll be helping develop, infographics that we can post on social media platforms or blast in different WhatsApp groups that we have. Looking at your experience as a whole, if you're going for a week, even 2 weeks, a week can go by really fast. And so I really encourage you to make the most of your time on site, even if you're going for longer. Again, just make the most of your time. Hopefully throughout this experience, you will gain cultural competence as you'll be really immersed in the culture, living with a family, working day in and day out at the clinic. And so really take in that experience. As I mentioned, FIMRC focuses heavily on health education. And so hopefully that just increases your awareness of the value of health education in both public and global health and the importance of that. Hopefully you'll gain that deeper understanding of what sustainable development looks like. And then you will also be receiving trainings on the healthcare system in Costa Rica. And so that will just help increase your understanding of what that looks like and kind of a different healthcare service and system that exists within Costa Rica. You'll gain deeper relationships, hopefully with other volunteers that might be on site, our amazing FIMRC staff. We refer to ourselves as a FIMRC family. And so hopefully you become a part of that family during your time on site, your homestay families, just a lot of opportunities to make new relationships and kind of develop those deeper relationships. And then we found that these trips are also very pivotal for a lot of our volunteers in kind of guiding them where they want to continue with their studies or their future career. And so they really can be life-changing as well. A few cultural differences to be aware of. It is a much slower pace of life. Costa Rica, doesn't run on a tight schedule in general like us. And so your transportation will most likely be late a few days. Patients will be late for consults. Things just happen at a slower pace. And so especially for you type A people that like your schedule, just be aware of that it's probably not going to happen according to schedule. And so again, being flexible and just willing to adapt to that situation is really important. Of course, the language, as most everyone will be speaking Spanish. Our site staff is bilingual in both English and Spanish, and so they will provide most of the translation at the clinic. Your homestay families, however, do not speak English. And so you will be practicing that Spanish of yours. I recommend downloading some type of translation app on your phone, as that will be really easy if you need to communicate something to your homestay family. You can put it in, translate it, and it just makes it a little bit easier to be able to communicate. Again, really put yourself out there and immerse yourself, make the most of every minute, and don't forget to have fun during your trip. In that pre-departure packet, you guys received a lot of information, including an extensive packing list. I just wanted to highlight a few things here. For clothing, we do require modest clothing. Longer shorts are okay, but typically what you see volunteers in this picture wearing is what our volunteers wear. Scrubs are optional. You do not have to wear them, but you are more than welcome to. And then I recommend you bringing a pair of comfortable shoes. You will be on your feet a lot, so make sure you have a pair of good, comfortable, supportive shoes. It can also get a little bit cooler in Costa Rica, and so I recommend bringing a light sweater or even a rain jacket, just in case it gets a little cooler. For medical supplies, we are requesting that each volunteer brings your own personal COVID-19 kit. In this kit, it will include your personal supply of masks. And so make sure that you have enough masks for the duration of your trip that you guys are packing and bringing, as well as your own personal hand sanitizer. And this just allows us to use the resources at the clinic for patients and our staff, as opposed to just providing that for volunteers. You guys should have all received a donation list. And so anything on that is wonderful and helpful for the clinic. In addition, the clinic is just constantly asking for boxes of masks and gloves, especially right now during COVID. I recommend that all volunteers bring at least one COVID-19 home test as well. And this is more for you. If you were to develop symptoms or get sick while in Costa Rica, it's a much easier way for us to test you. We'll get into this a little bit later, but the COVID test in Costa Rica runs around $100. And so if we have the home test, you won't have to spend that $100. You can test if you're symptomatic. You cannot buy home tests in Costa Rica, and so you would have to bring it with you.